Venlafaxine is a medication that is predominantly used to treat depression and anxiety, although it can be used for other disorders such as social phobia and panic disorder. In today's video, I'm going to share some important information about this medication so you can increase your understanding about it. Just keep in mind that this video is for information purposes only. I'm also going to share a crucial point about stopping venlafaxine at the end of this video, so make sure you stick around to the end so you can get the proper information and be able to make an informed decision if you do choose to stop the medication in the future. So before somebody is to start using venlafaxine, they should be screened for bipolar, hypomania, and mania, as this medication can actually cause these things in some individuals. We would also want to, as much as possible, avoid giving this medication to older patients, as venlafaxine sits on what's called the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. However, in some situations, the benefits would outweigh the risks. Now, when a patient does start taking this medication, they would generally start off on a lower dose, such as 37.5 milligrams or 75 milligrams, and then gradually move their dose upward as directed by the physician. The maximum daily dose of venlafaxine would actually depend on the reason that you're using the medication or what you're using it to treat. As an example, the maximum daily dose for anxiety is 225 milligrams daily, but if you were using this medication for depression as an inpatient in the hospital, then the maximum daily dose would go up to 375 milligrams per day. Most people seem to stick with a dose of 225 milligrams per day unless they're using it for some off-label things such as bipolar disorder depressed phase or OCD. The only reason this medication would be contraindicated, or you wouldn't be able to use this medication, really just lies in some drug interactions, so we won't dive too deep into this point because your physician and your pharmacist will screen for these drug interactions. Now, if somebody is going to use venlafaxine, there is a black box warning that they should be aware of. This medication, like many antidepressants, comes with a risk of suicidal thinking in adolescents and young adults. For this reason, you would be closely monitored for suicidal thoughts or behaviors throughout course of therapy, but really especially when you first start the medication. Over the course of therapy with venlafaxine, you may get some blood work done, so your healthcare team can check some indicators that will reveal to them how your body is handling the medication. Some of the things that may be checked are liver function, kidney function, or your cholesterol. Now, like I mentioned at the start of this video, if somebody did want to stop taking venlafaxine, it's very crucial that they're upfront with their physician about their intentions so that their physician can discuss it with them and make a plan of how to come off the medication appropriately. You can't stop taking venlafaxine cold turkey. You actually have to come off this medication more slowly, like I said, with that plan from your physician, or you could experience withdrawal symptoms that some people describe as brain zaps or electric shock syndrome. I made a full video specifically discussing this point, so if you'd like to learn more about this withdrawal symptom, just click on this video now. And that's all we're going to talk about today. Take care.